It's not a good way to begin, but I want to send my deepest regrets for not being there in person today. I would have loved to participate in the Unite to Cure this year because I've seen the impact of this conference. It's consequential. And I want to send my regards to Cardinal Ravazzi, as well as Monsignor Trafny, and to the Political Council for Culture, to the Secretary of State, Parolin, and Robin Smith of the Cura Foundation. You know, when I spoke to His Holiness in this community 2 years ago, I laid out what we thought was a bold vision for what we were undertaking with the Cancer Moonshot. We were joining a community of researchers, health providers, caregivers, advocates, and patients, like many of you in the audience today, to make a difference in the fight against cancer. Our goal is to double the rate of progress in cancer prevention, early detection, treatment, and care, to accomplish in just 5 years what otherwise would take a decade. I'm disappointed I couldn't be there today to lay out the specifics of what has been accomplished between then and now, but I want to take a couple of minutes to provide some examples, because I think it demonstrates what's possible when we challenge the existing research and care system and break down the silos to increase collaboration. We can provide real hope to patients and their families. Hope for another day, another month, another year, and maybe for decades, and maybe a cure. The White House Cancer Moonshot was started in 2016. It went from being a government program to becoming a movement. Federal agencies and private companies, nonprofit foundations, academic institutions, investors, innovators, all came together to create solutions to improve and even save lives. In my career of public service, I have never seen anything like the uniform goodwill, enthusiasm, commitment, and bipartisan support in this country of the Cancer Moonshot mission. And because of that, we were able to make great progress. In the final year of our administration as part of the Moonshot, we helped launch 80 collaborations and initiatives. Just this week, we hosted a forum to check in on the progress of some of those programs and continue to be inspired and motivated by what we learned. These include, for example, organizing new ways of doing clinical trials for patients, not just with patients. What started in the District of Columbia in Cleveland, Ohio, has now been expanded to dozens of cities and multiple cancer centers. Harnessing the power of prizes to develop better detection technology. Bringing genomic sequencing to within reach of populations that need help and fight against cancer, haven't been available to them before. Providing financial assistance to families facing cancer diagnoses so they can focus on health, not the bills and the burdens that they're under. Even helping people get a free ride to the doctor or hospital, it can make a difference. When we left the White House, many people came forward and encouraged Jill and me to continue our work to speed progress against cancer. The Moonshot showed us what was possible, but it's no longer enough to have demonstration projects and pilot partnerships. We have to make these successes the new normal. And so Jill and I launched a nonprofit organization, the Biden Cancer Initiative. Our response to the lack of cohesive, comprehensive, and timely approach to prevention, detection, diagnosis, research, and care. This is our way of continuing to challenge the system, of bringing the urgency of the fight, the urgency of now. And simply put, we're working to build the cancer research and care system people think we already have, and we should have. One that fosters innovation and creativity, that rewards risk-taking, that gives patients what they deserve, a system that puts saving lives above anything else. We're only as successful as the strength of the collective cancer research and care communities. And because of your commitment, the conversations that will happen over the next few days in Rome, most importantly, the connections and the community that will emerge, will all be stronger and more unified than ever to address the barriers that stand in the way of better health care for all. So I thank you all for what you do. Thank you for your commitment. I thank the Pontiff for his commitment. All of us, together, we can make hope real. That's what this is all about, making hope real.